Hello, I'm Peg Bulgioni, Marketing and Communications Manager for Southern Vermont AHEC, and I'm pleased to welcome you to another episode of Let's Talk. Our programs are focused on topics surrounding health workforce development in Vermont, as well as vital alliances we have nurtured with our numerous partners. This show will spotlight Southern Vermont AHEC's 25th anniversary celebration and our MedQuest Health Careers Expo, to be held on May 8th. Southern Vermont AHEC is a nonprofit educational organization dedicated to growing and sustaining Southern Vermont's health workforce, especially in our rural and underserved communities. Welcome to Let's Talk. We have a full show today, and so I want to get started. First, I want to introduce our guests. We have Jennifer Scott, the Executive Director of Southern Vermont AHEC. We have Arwen Turner, who is the Executive Director of Come Alive Outside. And we are also joined by Greg Horst, who is the Adventure Advocate for Come Alive Outside. I love your title. That's my favorite.
It's the best.
So everybody, welcome to the show. And again, we're going to get started. We've got a lot to cover in this half hour. So Jennifer, we'll begin with you. So we know that 2024 is a big milestone for Southern Vermont AHEC, and with the celebration of our 25th anniversary, and we know that Southern Vermont AHEC has a very rich and storied history. So I was hoping you could just walk us through when it all began.
Okay, well, I'd love to do that. Of course, I only know about the last 3.5 years, since that's when I took over as executive director. But I've learned a lot about the organization, and it is a pretty exciting program, the AHEC program. But it all started in 1997 with the visionaries at the University of Vermont, Larner College of Medicine. In the Office of Primary Care, they decided that they wanted to bring the federal AHEC program to Vermont because it didn't exist here. And so that group of really inspired individuals, led by Dr. Mimi Reardon, had applied for the AHEC grant program through the federal program, and brought the program to the Office of Primary Care at the Larner College of Medicine. And then a couple years later, we were established in the southern part of the state as one of the regional community facing centers.
All right, in 1999.
In 1999.
All right,
yeah.
So, and I think the original charter was maybe January?
It was January 26, 1999.
Right.
Yes,
Okay.
that was our birthday.
So we are in our 25th year, and very proud of everything that AHEC has accomplished and is continuing to accomplish in that time frame. So I know the original reason for establishing AHECs was to address the shortage of primary care physicians, particularly in rural and underserved communities. And do you believe that we, Southern Vermont AHEC or AHECs, have broadened our mission given the shortage of health workers across the country?
Well, we began as an organization to help increase the supply and distribution of primary preventative care providers, particularly in our rural communities. That was really the focus all along. So we still focus on primary care providers. What we've done, I think, over the years is we've looked at healthcare system as like the entire infrastructure, and looking at it's not just about providers, but it's all the other health professionals that make up the system. So we because there is a shortage, and there has been a shortage for some time, and it's multi-factored, it's not just a simple solution. But AHEC, in looking at it from a workforce development standpoint, we want to examine the reasons that medical students might not be choosing primary care anymore, or the fact that we have educational programs that have capacity, limited capacity, because they don't have enough educators in those programs. So we're constantly working with our community partners and to try to tackle at least one element of the shortage, so that all Vermonters have access to primary care. And I mean, that's the goal. And I think that we have like-minded partners that believe that that's really important.
So I know we don't have a crystal ball, but can you predict what the next 25 years would be like for Southern Vermont AHEC? What would be the major areas of focus?
Well, our organization is not static, it's dynamic, so it's constantly changing. We're not the same now as we were 25 years ago. But what's really important about how AHEC approaches it is we we look at the future health workforce. So while we have a lot of community partners that are working on the current shortage, we are looking down the road at how can we grow the future health workforce. So that means that we're looking at trends. We're paying attention to what is the workforce need going to be in 6, 8, 10 years from now, not just what is the need right now. So I would say that with all of the different projects and programs that we offer, all the way from middle school through high school, through college, to our graduate health profession students, I think we'll be continuing to keep our finger on the pulse of what our communities need, and what are the gaps between where we are now and where we're going to be in the future. Staying connected to the data that says where the trends are going. And if you look at healthcare trends, then you think of the advancement of healthcare technology. I think that that's going to be a really important game changer in the field, not only in the provision of healthcare services, but also in the receipt of services, in how we educate and train our providers. So it's exciting. It's exciting, but it's constantly changing. And then when we think about the technology, which is rapidly evolving, I think that there are some careers that we aren't even aware of now that are going to exist and come to be really important over the next 20, 25 years.
All right. And I know, Arwen, you've had a connection with AHEC, Southern Vermont AHEC, and through our C-SHIP program. So I just wondered, and you've been on the shows before, but I was wondering if you just elaborate a little bit about your connection to Southern Vermont AHEC through C-SHIP.
Yeah, so Come Alive Outside, we're a little interesting because we're not healthcare, but we're definitely healthcare adjacent, because what we do is we connect people to nature for health, wellness, and joy. And it would be really odd to do that inside of a bubble where we're not working with people who are working with those who are either going into healthcare careers or already in healthcare careers. And so we actually have this really amazing program called Nature RX. And how Nature RX works is that clinicians either refer people to us for a one-to-one health coach, and that health coach will set up individual goals that get people outside and moving in nature. And then you get that health coach for 12 weeks. Once a week you get a phone call. And we've seen that program, it's our highest touch program, has the biggest impact in people from starting to finishing the program in the shortest amount of time. Because you have someone who's holding your hand and checking in with you. For years we did this program having our staff or volunteers do those check-ins. And last year we were able to try a new way of approaching this with the C-SHIP program. So we actually were able to have 2 of the C-SHIP interns be the wellness and health coaches for the folks that were enrolled in Nature RX. And we've always had really great results with this program, but we are afraid to ever go back to what it was because of how amazing it was to have people who were actually certified health and wellness coaches be the wellness coaches for our program, and to have that separation where we as Come Alive Outside could focus more on collaboration and program, and they could focus on those one-to-one relationships. We've never seen the data come back so strong. That's great.
That's fantastic. And just for folks who don't know what C-SHIP means, it is an acronym for College Student Health Internship Program. And we've had it for what, Jennifer, 10 years?
10 years, yeah. This is the 11th year.
Yep, so, and very successful, I might add. So now let's talk about the upcoming MedQuest Health Careers Expo, which we're very excited about. And Jennifer, why don't you tell us how this idea came about and what's going to be happening at the event?
Okay. Well, our MedQuest Health Careers Expo is intended to do a couple different things, but most importantly, it was just a way to bring all of our community partners together and just celebrate what AHEC has been and is and will be in the southern part of the state. So it's really exciting, but our expo is not intended to be a job fair. It is really an exposition of all the different types of health careers that make up our healthcare system. So anything from our advanced practice folks, patient-facing types of careers like doctors and nurses and dentists and behavioral health specialists, to food and nutrition, to athletic training, to coding, to all the other positions that help, make patient care so awesome. And so we have more than 30 different exhibitors and additional vendors that will be at the expo, all showcasing some hands-on activity to engage young people. We're hoping to attract those who are ages 14 to 21, but it's open to the public and free to everyone. So we're really excited about it, and we are especially grateful for our partners, Come Alive Outside, and getting to engage with them on this really exciting event. We've never done this before. And we want to offer a special thank you to our sponsors, Rutland Regional Medical Center, the VNA and Hospice of Southwest Region, Community Health, Transfer, which is a healthcare training VR simulation company, and Springfield Hospital.
All right. Well, thank you. Thank you very much to all of them. And just to drill down a little bit, Arwen and Greg, maybe you can explain a little bit about what your role is going to be during the expo.
Well, Greg, adventure advocate, why don't you tell them how we're going to make this so fun?
So in partnering with y'all, we have our mobile passport application, which we've been using with youth in elementary schools and then adapted to a mobile passport app. One of the applications we can do with this is for an event like the expo, we're able to have an activity associated with each of those 30 different booths and vendors where you are going and completing the activity that is already at the booth and getting points to then turn around and turn in for prizes. And we found that kind of gamifying an activity that somebody might already be doing increases the amount of activities they're going to do. So instead of, I hit 1 or 2 booths and okay, I've seen the things I want, they're now going to see things they might not have, which for youth looking at what their future might hold, they don't know necessarily what is going to be the thing they want. And so if you show up to something else, you're going to learn more and, maybe I would like that because I talked to this person at that booth. And so we're really helping increase the engagement that's going to happen at the event through the application.
All right, and so it'll be and so what about incentives? So for the people.
Yeah. So
Prizes.
prizes.
Music and food.
That's right.
So as you complete each activity, you get a number of points. Those points get turned in for prizes. Those prizes are coming in a couple of different factors. We're going to have a separate booth that's kind of a skill contest with Nerf toys that you can try and hit targets you can use your points to get darts to use at the target competition. You can also use those points just to get general prizes. But the idea really is that once you get involved, it's a kind of a steamroller effect of, I've done 2. Well, if I do 2 more, I get this many more prizes. I get this extra thing, and now they've absorbed that much more information instead of coming, hanging out with friends and doing a couple of booths. So they're going to maybe see all 30 of those participants and vendors that are happening there.
All right. And so let's drill down a little more, Jennifer. You want to give us a hint about some of the other activities that might be at the expo?
Oh, sure. Well, the key to this is exploration, and Greg really hit it there, that it's the idea of exploring all these different careers that they might not have heard of before, and incentivizing them to go around to each one of them. One of the other prizes that we have is with our sponsor Transfer, which They do training in the healthcare industry using virtual reality. So we have some virtual reality headsets that we will be giving away to the schools that have the greatest number of students in attendance, as well as for anybody who's in attendance. We'll also have additional drawings for some of the smaller schools. And as Greg mentioned, we've got the prizes that are related to the gamification and earning the points to get to each one of the different exhibits. And let me think, what am I missing?
Well, we've got some VR simulations.
Oh, well, yes.
That'll be,
the
and,
VR headsets.
And then we're going to have some mobile medical units, I
Yes,
believe, on
that's
site.
right.
Some EMTs, people, the students are, we want, I think, people to understand that this is more than just physicians, nurses. It is a huge spectrum of health careers
That are all needed.
That are all
So
needed,
yes.
and huge. And so we want kids to have as much of an immersive experience as possible when they come to this. So.
And we'll also have our educational partners there, because the important thing about exploring a career is also understanding what are the resources available for students who want to pursue that career. We'll have our employers also there to engage students in what are some next steps, what are some entry-level positions that they can do right out of high school, or what are some of the other paths to certification that they might not be aware of. So it's really important for us to integrate all of these different resources and supports so that when something sparks for a student, which is a really fun thing to see happen, that they also know that there's a path there for them to go on the next steps.
So Arwen, as someone who works closely with youth, how important are these types of career events for young people, and why should they come?
Yeah, and I would say I'm not an expert on youth, but they are around me all the time. But I think that, just hearing Jennifer talk about all these different jobs and the different ways that you enter them and the different ways you could show up, I don't feel like I had that opportunity when I was younger. I think I knew you could be a nurse and a doctor, or maybe someone that checks in people. I didn't know about all of the variety of all these healthcare jobs. So I think, in healthcare, if there's an interest there, that's all about increasing quality of life, and also thinking about representation. You might not see yourself in the positions you're seeing around you in healthcare, but there's space for everyone there. So we're really excited just about seeing all kinds of people come out and just learn about what might be something fun for them to try that they've never known about, VR, that's so awesome. So maybe you really like video games. You're not interested in being a nurse or a doctor or a PA, but that might be the thing for you. So I just think it's just about exposure and jobs. Also, when you have a job, you can buy cool stuff like skis. You can get outside.
Well, I think you're right. Healthcare is recession-proof, that's for sure. I think there's always going to be some kind of opportunity, some kind of job available. And I like, Jennifer had mentioned it earlier about the different pathways, for students to take for health career. And there could be barriers in terms of financial, social, but the fact of the matter is that it's a stepping stone, it's a ladder, to success. And I think a lot of schools are recognizing that, in hospitals, employers, and recognizing that there's opportunities for these folks to grow and to prosper in their health careers. I know a lot of hospitals offer tracks where you start out as an LNA, but you can advance to be a registered nurse and maybe even a nurse practitioner. That's the right way to do it. They call it grow your own, I believe. So. And
we call those also stacked credentials. You start in one place, and while you're earning a living, and so you're serving the community in your job role, but then you can also learn and grow with the support of your employer to advance your education, to get additional training. There's lots of incentives within the field to do those things, and you can move at your own pace while you're also working.
Right, and so there's going to be hospitals represented, community health organizations. You could probably fill in some of the blanks here.
All the different sectors, all the different sectors of healthcare. It's really exciting. We have folks from oral health and public health and medicine and all the different specialty areas to food and nutrition, environmental services. Did I mention behavioral health?
No.
Behavioral health, which is my area. How did I miss that? Behavioral health, prevention. So it's exciting to see all of them under one roof. And what's also really fun is to see how much the people who are running the exhibits enjoy their career. They volunteered for this to showcase the things that they love about what they do for a living and what they've chosen.
And I know that it's the it's designed for young people that, you know, may not have a plan. They may not know what they want to do. They're curious about healthcare, what the options are, and it's also for students that are a little more focused and want to learn more about a particular career. So, I mean, it's really for everybody, and we want to make this as inclusive as possible, and we invite parents or, you know, friends to bring these young people down, or the young people to come down on their own, because it is from 3 to 7.
And everybody is welcome.
Everybody is welcome, absolutely. But I was just curious about, I know that this is the first one of its kind, I think, this type of expo that I'm aware of.
Well, for us, there are have been a couple around our sort of tri-state area, because it's so important to be able to engage people on all different levels. I think what's unique about the one that we're doing is that it's focused on young people. And it's not necessarily a job fair where employers are looking to fill open positions. Well, there may be some of that there, because, you know, it's a good opportunity for employers to do that. But it's really about the exploration piece, and that fits with what we do at Southern Vermont AHEC and what Come Alive Outside does. It's about youth development, as you said, tapping into the curiosity, natural curiosity, and fun, you know, just to come out and have a good time and see what there is to offer. It's kind of amazing how much this region has to offer.
It does, it does. And the cool thing is that it is going to be a fun event, but they're going to probably learn something or take something away or make a decision about their future. And so all those things are very, very important. And I just wanted to just emphasize again, it's at the Rutand Recreation Center down on Community Drive, and it's from 3 to 7 on May 8th on a Wednesday. So please come and tell everybody about it. We're trying to really promote this region-wide. And I didn't know if anybody had some final thoughts just about career exploration, about AHEC, about the event, Come Alive Outside, that you wanted to mention before, you know, we signed off.
Well, it is a good opportunity for after-school programs. If you're looking for, you know, an activity to do, bring a busload of kids. That would be a lot of fun. But I think that what it's also showcasing is the partnerships that we have, the ones that we've built, the ones that we strengthen, that everybody comes together to focus on some of these really important areas. I mean, this is about the health of our community. When we connect students to careers and professionals to communities and communities to better health, I mean, that's really the key. That's what's important about what we're doing.
Absolutely.
Yeah, and we are just, I mean, we're so excited to be part of this. You know, community health is at the core of what we want, right? We want healthy, happy people, as happy as you can be, as healthy as you can be. And I think it's just also, for us, it's just a time for us to test out something new. We're so excited about the Passport program being on a mobile app. So thank you for the opportunity. I also know that we are getting some really cool new prizes and bringing out some of the very coveted prizes. So those Viking helmets that light up, those will be there. Poop bags, those will be there. We have some new Bigfoot keychains, new sunglasses. What else will we have for prizes?
Poop bags.
Got to go through the inventory.
Possibly some spork knives.
Oh, I forgot about the sporks.
Spork knives.
Oh,
yeah.
Those are really cool.
The camping ones, not the ones from KFC.
Not the ones you're getting, but to take camping with you as you go.
Reusable.
I like those. Not the KFC ones.
Everything's recyclable and sustainable.
Yes.
That's right.
And for the grown-ups, there's a 50-50 raffle.
That's
so
right. We
there's a
didn't
prize.
forget
that.
There's a
Ooh.
prize for you.
That's right. And
You can enter all the way up to the event. It's also accessible online through our website, as well as we'll be selling tickets the day of.
that's right. And our website is www.svtahec.org. So please, there's a lot of information about the expo on our website, and please follow us on our Facebook page. We are, all over social media. So I think we're going to wrap up, and thank you all for being part of this show, and we're just going to we know it's going to be successful. We're really excited, and we hope that you can come. Thank you.